Hi everyone, I'm Andre. Today we're going to talk about a case study where this patient has really itchy skin. So according to him, he had this problem before, but it wasn't very serious until about a month ago he went dog sitting for his friend. After staying with the dog, he noticed the skin condition has gotten a lot worse, and it's itching very severely. And when it happens, he couldn't do anything. Basically, the day is a write-off. He couldn't work, couldn't do anything at home. So he wanted to get it resolved. And according to him, his chief complaint also includes fatigue. So he's very tired, like stamina and energy-wise. He said that even if just walking in the mall for like half an hour, he would need to sit down and take a break. He's also aversion to cold, heat, and wind. So this is more of a TCM term, meaning that when you're exposed to cold or heat or wind, you get very discomfort. So some people have one of them or some of them, but when we see this person has all three, that it does mean that his body is more weak. His superficial tensed. His superficial part of the body is more deficient, more weak. And then the next thing is stuffy chest. So when it's in a room with like stuffy air without airflow, he has some sort of difficulty breathing. Some people would say it's like lack of oxygen. And when it's summer, if he's exposed to the sun, he can easily get a sunstroke. So these are what he mentioned when he came to see me. And during the examination, I found out that he doesn't have much appetite compared to before. And then he will get diarrhea if his abdomen is exposed to wind or exposed to cold. So I don't know if this is common or not, but in terms of TCM, when we see this, it means that the temperature of your GI tract or your intestine isn't high enough. So when it's exposed to environmental factors such as cold or wind, the temperature will reduce and it will cause abnormalities like losing. So basically, when your intestine is not at a working temperature, it gets too cold, and then it might be moving too fast, causing diarrhea. So this will be that case. And he also mentioned that he has noticed like there's foamy substance in the urine. I know some people like they never pay attention to what their urine looks like or what color it is. So this patient is very aware of how his body, his status of his health. So at the first visit, he gave me lots of useful information, so I could quickly diagnose him and gave him the right medicine to help him. And he also mentioned that about once or twice in a week that he would had this unfinished urination. So like you thought you were finished when you were peeing, but when you pull on the pants, you feel like, okay, there's a little bit more, I have to go again. Or it can be like when you're finished, when you thought you were finished, and you pull up the pants and then you notice there's maybe one drop that came out. So this So this urination indicates that there's some sort of there's some issue with the bladder or even with the kidneys. And the next thing is he is very, very thirsty. Like whenever he talks a little bit, his mouth gets really, really dry, and he drinks at least about 3 liters of water a day and still feel the mouth is quite dry. The next thing I noticed, I asked him, like, because when I saw him, as soon as he walked in the clinic, I can see that he has more of a pale complexion. His body is very slender, even though he looks very fit, but you can tell he's a little bit on the weak side. And this type of person, like with the pale skin and slender body, plus what he just told me, I can quickly just kind of conclude that this person has a weaker constitution. So his body is more like a deficient type of body. So, and this is something that would happen when your body is more deficient. So I asked him, do you get dizziness? Do you get darkened visions when you, let's say, bend down, tie your shoes, and stand up very quickly? He said, yeah, maybe 1 or 2 out of 10 times. And if you're familiar with Western medicine's term, what is called, sorry, I kind of having a brain fart today. Anyways, so the technical term is you have some sort of blood deficient. Anemia. Yes, anemia. And when you bend down and stand up quickly, your vision gets dark. You might see some sparks. In Chinese medicine, it's not exactly anemia, but it's basically it's an indication of your heart isn't strong enough when it's pumping, even though it's pumping at a regular speed, like 72 beats per minute, but it's not like pumping strong enough. It's like maybe it's like this at 72 beats per minute instead of like this. So that makes a difference. And so after all these intake, and then from what is said, I did abdominal check on him, and I've noticed there's pulsating just above his abdomen. So this is considered a type of palpitation in Chinese medicine. So again, meaning the heart isn't strong enough, and also meaning that there's some sort of water accumulation in the intestines or in the tissues in this region. That's why it's more amplified. So the palpitation, the pulsating, comes from the aorta. It's the biggest arteries from heart down to our lower body. It goes like this, but so when there's water accumulation, it kind of amplifies the pulsing. With this patient, his upper abdomen is also has a drumming noise when I'm checking. It means that there are lots of air accumulation in the stomach and intestine area. And when I apply some pressure, he would burp. So that confirms there's a lot of air in the GI tract. So for a healthy person, our intestines shouldn't have so much air. And even if there's air, we can quickly resolve it by passing gas or burping rather than accumulating everything here. After checking his pulse is wiry. So this is a bit more technical. When the pulse is wiry, it can indicate 2 things. 1 is liver gallbladder issue, or 2, there's water accumulation. So when I was checking his abdomen, there wasn't any signs of liver gallbladder damage. And so I crossed it out, and that left out was water accumulation. So that kind of fits the whole picture here. So you would think, okay, well, this person has water accumulation, then how come he's so thirsty? This water accumulation you can consider it's a type of, it's not the type of water our body can utilize. It's kind of disrupting our normal water metabolism. Actually, it's disrupting our body functions. So imagine like, so if this is a pipe, and this is the patient's mouth. The water comes from absorption from the intestines. It has to go up to nourish our mouth, right? But in the upper abdomen area, there's some sort of obstruction with the bad water or the toxins. So it kind of stops the water from sending up to the mouth. So that's why this patient was very, very thirsty. And once we resolve this water accumulation, the thirst will be much better. So, so summarizing everything, I quickly prescribe him Ling Gui Zhu Gan Tang, which is Fu Ling Gui Zhi, Bai Zhu and Gan Chao. Fu Ling is Poria roots, so it's a type of medicine that help us get rid of excess water and improve water metabolism. Guizhi is cinnamon branch, which strengthens the heart and also helps with our superficial circulations. So even though this patient comes for skin itchiness, but in TCM, we have to look at the whole picture, see what's causing this issue, rather than, if you go to your family doctors, he would only look at this, and he will prescribe medicine or whatever according to your disease, rather than your body, the whole picture. So that's why TCM is such a good medicine that it complements the modern medicine very well. When modern medicine fails, there's hope in TCM. So the guizhi, the cinnamon branch, will help with the superficial circulation, strengthening the heart, addressing this aversion to cold, heat, and wind, this and that. So quite a few things. And Baizhu is I forgot the name. Basically, it's a root of a plant that helps with when you have swellings in your body. So like water accumulation type of swelling, like puffy eyelids or puffy face or water or puffy legs. Also it gets rid of excess water in your digestive system. And ganchao is just licorice, but it's honey fried licorice. When something is honey fried, it has a sweeter flavor, and sweeter flavor tends to nourish the body very well. So this person, as I mentioned, is more deficient type of body, so we need something to nourish him, to give him more nutrients. So his fatigue can also be addressed. After a week of taking the medicine, he reported back that the skin was 80 to 90% better. His energy level is surprisingly went back to as high as his peak at 5 years ago. His appetite was also back to normal. Urination's better. The only thing that was a little bit better only was his thirst. So I added one more medicine which kind of to help him replenish fluid in the mouth. So that's what I did the second week, and after that his thirst level went down to like maybe 2 liters per day. He doesn't get dry mouth as quickly as he used to do. So this is a very successful case because everything kind of pointed in one direction. So some patient can come in with their symptoms pointing, tells me, okay, this is probably an A pattern, and his abdominal check can tell me this is a B pattern. His pulse could tell me, okay, maybe it's C pattern. So when the patient with complicated syndromes like that, it's more of a difficult case. It takes a little bit longer time to get to prescribe a very fit medicine for this patient. So luckily this patient, everything points to one direction, and he recovered very, very quickly. So if you have any comment or any question, please feel free to leave it below. And if you have similar issues, skin issues, or you're not getting help from your family doctor or your specialist, why not give TCM or acupuncture a try? Because whatever they fail, we can succeed. It's a good complement for the current modern medicine. And if you want to come see me, you're welcome to do that as well. Go to my Facebook page, or you can go on to my website to book an appointment. Now we have 2 locations serving you better. One in downtown Vancouver, one in Burnaby Metrotown areas. So that's it for today. Thank you. See you next time. Bye.